So you all have heard about the two patients who are in their 70s who recovered from COVID after they got ivermectin. And then everyone was kind of in the dark of what happened to the third patient who was in her mid-90s. Well, I just got news this week from Alberta that she made it out of the hospital as well. She's back in her usual nursing home, so that makes it 3 out of 3 who made it out of hospital because of ivermectin. So I heard while I was away, the day before yesterday, Bonnie Henry had some kind of a press conference, and during the press conference, a reporter asked her what she was going to do about taking away the license of doctors who write vaccine exemptions. I haven't seen that actual press conference. Is it true? What did some reporter ask that? Oh wow. So, someone needs to get me the name of that reporter and what journalism school he or she graduated from. Because you know what? I need to talk to the dean of that university. They shouldn't be graduating people from journalism school until they start to learn how to ask questions. Because she could have emailed me, she could have phoned me, and she could have asked me why I was writing vaccine exemptions. Because I would have told her. I write vaccine exemptions for cancer. Anyone in your family has a history of cancer, I'll write you a vaccine exemption. Nobody knows how much cancer this new injection will cause, because it takes 20 years to find out any new drug, any new therapy. It takes 20 years to find out how much cancer it will cause. And then I know there's some pseudoscientists who claim they know the science, who will say, well, I can't prove that it doesn't cause cancer. But let me talk to you about theoretical science, because I did microbiology and physiology at McGill. So if any of you are listening, all these pseudoscientists who think this vaccine is safe, let me educate you on microbiology and cell biology. So in the human genome, there are retrotransposons, and retrotransposons contain endogenous reverse transcriptase. That means anything that's mRNA or RNA, if it gets inside one of your cells, it's just a matter of luck whether or not that cell reverse transcribes that mRNA back into DNA. I will repeat. Every cell in the body has retrotransposons. Every retrotransposon encodes a protein called reverse transcriptase. This is not the reverse transcriptase that's a part of HIV. This is human reverse transcriptase. So anyone who tells you that mRNA cannot change your DNA is absolutely wrong. So the worst part of this is human endogenous reverse transcriptase is most active during embryogenesis, when you're still a fetus. And then it gradually decreases in activity as your development through embryogenesis, birth, infancy, childhood, teenage years. So the people most at risk of DNA changes from an mRNA vaccine are people who are still developing. Then that's children. Children are most at risk for genetic DNA changes from an mRNA vaccine, because children have more endogenous human reverse transcriptase activity than fully grown adults, because they're still growing. The other mechanism of cancer that can be caused, especially when you give children an mRNA vaccine, is immune lack of specificity. Because this mRNA vaccine is telling cells to produce a non-human protein, the spike protein. Why on earth are you giving children whose immune systems are still developing and learning to tell the difference between good cells in the body and bad cells in the body, why are you telling the cells inside a child's body to produce a non-human protein? And what that will do from a basic immunology point of view. And I am really, really upset at the number of doctors and immunologist specialists who should know what I'm talking about, who are not speaking up. I have a message for those immunologists and pediatric specialists. You better listen and you better remember all the stuff you learned in medical school, because this is why you were taught that. During development, during childhood, the body's immune system has to differentiate between normal cells that are supposed to be present in the body and abnormal cells. If you give the child's body, the cells in that child's body, an abnormal protein and tell those cells to start manufacturing toxic, non-human spike proteins, then there's a good chance that that child's immune system, which is still developing, might say, oh, there's nothing wrong with the body's own cells producing non-human proteins. And so what that will do is 10 years, 20 years, maybe even 30 years later, when eventually through living, sometimes hard work, stress, being exposed to chemicals, when one of those child's cells mutates, and what the immune system should do is recognize the mutated cells that hasn't had a healthy diet, or maybe that cell ate too much McDonald's or something, it should eliminate that cell because it's not producing normal proteins. But if 20 years earlier that child got a spike protein vaccination, that immune system might not be able to recognize the cancerous cell anymore, because that immune system got used to seeing normal cells produce abnormal proteins. So that increases the risk of cancer. So now we're at two reasons why mRNA injections can cause cancer, especially when given to children. One is retrotransposons and reverse transcriptase. The second is immune lack of specificity. Just when a child's immune system should be learning how to make the fine differentiation between cancerous and non-cancerous, you're poisoning that child's immune system with an abnormal, non-human spike protein. But wait, there's a third reason why these injections might cause cancer, especially in children. Children's bodies, the cells in their bodies, should only be making proteins for growth and regular daily cell activities. So when you give cells of the body